Yes, good morning. It's a beautiful morning in Lagos, Nigeria, and I'm sure it's a beautiful morning, afternoon in China, and it is a great pleasure to be on this program today. I'd like to thank the organizers of this program, HIFU, and for everybody who has made this possible. My name is Abayomi Ajayi, and I'm the MD of Fibroid Care Center at Nordica here in Lagos, Nigeria. And this morning or this afternoon, wherever you are, I'll be sharing our experience with HIFU in the management of uterine fibroids. I bring you warm greetings from Lagos, the city of aquatic splendor. And my next slide, please. Yes, and this is one of the local festivals in Lagos, Nigeria. And this is quite popular. It's when the spirits come calling on human beings. Anyway, I'll give more details about that future one. Can I have the next slide? Thank you. Yes, right to business now. Uterine fibroids are the most common pelvic tumors in women before menopause, especially in Africans, where there is an approximate lifetime risk of about 70 to 80%. And there are many treatment options for this. Of course, since it's a very common tumor amongst us, there are many management options available, from expectant management to medical therapy to non-excisional procedures like uterine embolization and, of course, HIFU or high-intensity focused ultrasound, to the most popular one being surgery, either myomectomy or hysterectomy. When we talk about surgery, we are talking about whether it's open myomectomy or hysterectomy, or we're talking about laparoscopic myomectomy or hysterectomy. All these are available in Nigeria, though laparoscopy is like available in about 10% of centers in Nigeria, but it, of course, is gaining ground. My next slide, please. Yes, and some of the things we consider when choosing how to manage uterine fibroids, of course, is the age of the patient, the symptoms being expressed, if any. What we say about fibroids, sometimes when fibroids don't trouble them, the location of the fibroids, and that's why it's so important for us to use the FIGO classification of uterine fibroids to be able to see exactly where the location is. And then again, we consider, does this patient still want to have children in the future? These are important factors to consider when we're looking at all the options available to be able to make up our mind, to be able to give the right option to the right patient. Next slide, please. Yes, right now in Nigeria, myomectomy is the commonest surgery for uterine fibroids. And it represents between 75 to 90% of the treatment of uterine fibroids in Nigeria. So that shows us one thing: the majority of the women who have fibroids in Nigeria also want to retain their uterus. So, and that's why they're doing more myomectomies than hysterectomy. And that's very important as we go along. Next slide, please. Of course, we know that the complications from surgery could include hemorrhage, the need for blood transfusion, anesthetic complications, and sometimes inadvertent hysterectomy. I mean, that's when you don't plan the hysterectomy, but during the surgery, you have to end up doing hysterectomy. And don't forget what we said, that majority of the people who are doing this myomectomy, they're doing it because they want to retain their uteri. And then we have some other late complications that will arise from this surgery, like embolic phenomenon. Some of them have PVT, some have pulmonary embolism after that. And because of the surgery, sometimes also some will develop intrauterine adhesions, which we further prevent them from getting pregnant. And some we have recurrence. So these are some of the complications that come from the present situation of things. So my next slide will talk about how HIFU is transporting us from the present reality where we are into the future. Can I have the next slide and then you can interpret? So this is what HIFU is doing for us in Nigeria right now. It's taking us from the present, which we have painted the complications, the inherent complications, and it's taking us to the future. which we hope will be less filled with complications, and we improve the quality of life of our women. And the million-dollar question most of the time is, what is HIFU? People ask when you say HIFU, 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 because probably they've never heard of it before, especially in this climate, Nigeria and other parts of Africa. So HIFU is high intensity focused ultrasound, and is a non-invasive technique that uses non-ionizing ultrasonic waves to heat or ablate tissue. And the principle is so simple. It's like almost child's play. You know, many years ago when we were kids, we used to play with magnifying lenses, and we can converge the rays of the sun to a particular spot and put a piece of paper there, and usually you will see catching fire. And that is the principle of HIFU. Converges ultrasound rays, and then at the point at the focal point, there is heat energy being released. And that's how this works. And it burns that precisely at that point. Next slide, please. Yes, this is not a new thing. The Fry brothers in University of Illinois were the first to think about how to use this convergence of ultrasound rays, and they tried to use it for ultrasonic neurosurgery. And this finally led to the first commercial HIFU machine, which was launched in Europe in 1994, called the Sonoblade 200. And of course, there have been vast improvement on this machine to what we have right now. Can I have the next slide, please? And this was what actually, this picture is what changed the whole landscape in Nigeria. I'm probably in Black West Africa. When I came across this this wonderful team from HIFU in somewhere in Singapore. We had this picture in Singapore. And of course, you recognize Professor Wong and you and Rosie. And yeah, it's a beautiful team. And we had this meeting that finally led to us introducing HIFU into Nigeria. Can I have the next slide, please? And of course, we all know this is the JC200, which is the machine that we have right here in Lagos. Probably you also have in many parts of the world right now. Next slide, please. So how does HIFU work? Okay, this involves using a transducer, which is a transducer. This is what I'm pointing at, to concentrate ultrasound that can penetrate easily through human tissues into target lesions. Like this is a fibroid, and or sometimes when you also have adenomyosis with it, and then you guide this focus or the energy with either through MRI or ultrasound. Of course, the HIFU machine uses ultrasound guidance. And what happens at this point is that the energy of the ultrasound, the acoustic energy of the ultrasound is converted to heat at the point, at the focus where the focal point. And then this raises the temperature at this focal point about 60 to 90 degrees centigrade, and it causes irreversible and instantaneous coagulative necrosis at the target tissue. This is like heating up the tissue, and then because the tissue is made of protein, when you raise the temperature, it goes into coagulative necrosis, and then you sort of kill the target tissue at that point in time. And so that's how HIFU works. Can I have my next slide, please? The question most of the time, next slide, please. The question most of the time is that it's HIFU for everyone. And we say no. Unfortunately, as good as it sounds, we wish it could be for everyone, but it might not be. It's not everyone who can, especially in our own environment where we need to also, and in every environment, need to be able to choose the right option for the right patient. So because the focal point is about 12 to 14 centimeters, we need to make sure that we have enough distance where the ultrasound can travel. So when patients are significantly obese, then it might be difficult to use HIFU on them. So the cutoff point that we have used in Nigeria also, which also in many parts of the world, is that patients should not be more than 120 kg for them to qualify. But these are relative contraindications. They are not absolute contraindications. What we do when you have any of these relative contraindications is that we must do a simulation and see that you can do, it's possible to treat you via HIFU before we go on. For patients who have had a previous surgery and is a midline vertical incision, also we need to be wary because when we're using HIFU, the fear of the gut is the beginning of wisdom, like I say. So we are always mindful that the intestine is not attached to the midline vertical incision. That might not hold if you had a transverse incision, which we call a phanestal incision. Then the fibroids type 0 and type 7 fibroids, this is a type 0 fibroid. This is not a fibroid that is suitable for HIFU. This kind of fibroid is better treated with hysteroscopy. But what we are doing now sometimes is that because the majority of our patients don't just have single fibroids, they can have a lot of fibroids. And so even if you have a type 0 and you have type 4, you have type 3, all of them in the same patient, we can do HIFU for the other types and still come to do a stereoscopy for this type 0. But like I'm saying, like I said, type 0 is not a very good fibroid for HIFU. The second type that is not particularly very good is the type 7, the subserous pedunculate. This is also not a very good fibroid for HIFU. This is better done laparoscopically. When we say type 0 and type 7, then these are not the best fibroids for HIFU. Patients who have had a previous history of abdominal liposuction also, we need to be very careful with them. And patients who are not suitable for analgesia and sedation, since we don't use anesthesia in HIFU, what we use is analgesia, then we try to avoid this also. And patients who have communication difficulties are also not a no-no for HIFU, since they need to be able to communicate with us throughout the procedure. And so if you are not able to communicate, this might be a no-no for HIFU. Can I have the next slide and then you can take the presentation? Yes, now, so we've looked at the relative contraindications, but now we talk about the absolute contraindications. Patients who cannot have HIFU at all. Patients who have had a history of radiotherapy on the lower, or if you've had cancer treatment or any reason to have radiotherapy in your lower abdomen, then you might not qualify. Patients who have fibroids who are suspected of malignancy. Once we suspect malignancy anywhere in every region, we do not do HIFU. And that's why we also, before, one of the things we do is to do a colposcopy, also to see that there is no cervical fibroid. If we see ovarian tissue that is suspected of malignancy, we don't do HIFU. And the last category of patients are patients who cannot lie prone for at least 1 hour because either they have orthopedic lumbar diseases or any other cause of cardiac diseases that cannot make them lie down for at least 1 hour. They do not qualify. So those are the very few patients who don't qualify for HIFU. Yes, thank you. Next slide. I think you're good. Okay. Maybe you should interpret that and then we go to our experience in Nigeria, what we have done in the last 1 year. Experience in the last 1 year at the Fibroid Care Center. Well, significantly, today actually marks the first year anniversary that we commissioned this Fibroid Care Center in Lagos. When Samuel and Dr. Zia were here in Nigeria to help us in setting up this clinic. Now, as of yesterday, we have done 143 patients, but I'm presenting minus the one we did yesterday. We've done we did 142 before the this presentation was prepared, we had done 142 patients in 1 year, and the 116 of these were uterine fibroids alone, and in 20, the fibroid coexisted with adenomyosis, and in 6 patients, only adenomyosis alone. Of these uterine fibroids, 87% of them were hypointense, which means they're very good for HIFU, and the 13% were hyper intense. Can I have the next slide, please? And this is an example of hyper intense and hypointense that we're talking about. Yes, fortunately, majority of our fibroids are hypointense that we've seen so far. Next slide, please. Then, yeah, we could see when the presence of adenomyosis, the thickening of the, and then we can see when fibroids coexist, and yes, next slide. And this is the demographics of the patients that we have seen. They're between 24 and 50 years, the patients that are presented to us, 142. And out of this, 53% of them also have, just like we said, when we're looking at the present future of a situation in Nigeria, that myomectomy is the commonest reason why the surgery that is done for fibroids in Nigeria. We see why this is so, because a large number of them also have infertility. And that's one of the problems we're having now, because some people think that their infertility will also be cured once they have, when they do HIFU, treating the fibroids will also treat infertility. And that's one of the things that we're trying to let people understand, that fibroids does not necessarily have to be the cause of infertility. So, because we know also that there's a lot of male factor infertility. In the 142 patients, we calculated the average ablation rate. And this means that when we're doing the treatment, we use sonoview to microbubbles to see what percentage of the fibroids we are able to ablate. And our average ablation rate is 85%. So, and this is so good, because this is like what you want to dream of when you are ablating fibroids. And we're not, that's probably because the majority of our fibroids are hypointense. So we've been able to achieve an ablation rate of about 85%. Next slide, please. And when we look at the shrinkage rate, 3 months, 6 months, and 9 months after, 73 patients have been able to have 3 months post-HIFU shrinkage rate using ultrasound, and the average shrinkage rate is about 35%. 6 months post-HIFU has been about 7%, and 9 months has been about 7. We've not had any yet who has had, I think only, yeah, we had one. I think we've had one now who has had 1 year post-HIFU shrinkage. Well, please, next slide. And because about 53% of our patients have infertility and who might be candidates for IVF, we are also following them with post-HIFU hysteroscopy. And again, because some of them, 26 patients have had this hysteroscopy post-HIFU. And this is the finding: 6% of the 6 out of the 26, it was just diagnostic. There was nothing to remove. But as many as 20 out of the 26 had to have, they had submucous component to their fibroids. This is not really something that is strange to us, because a lot of our patients have multiple fibroids, and they're usually very big. And so it's not uncommon. So out of the 142, 26 have already had post-HIFU hysteroscopy. And then because, of course, again, 53% of them have infertility. So we need to be able to know that everything is all good before they start there. Now, only 4 patients have had IVF with us after HIFU. And unfortunately, I think they're still in the majority of them are still in the euphoria, thinking that HIFU also cures their infertility. So you see 43-year-olds coming and saying that I want to use my eggs because they feel good now, and they think also that the quality of eggs is improved. And that's one of the things, the challenges we are trying to take them through now. But one of the patients who is of good age has had who had HIFU for fibroids and adenomyosis, is now pregnant after IVF treatment. We just hope that we get more of this so that we can also be able to collate the data and be able to tell who are the best patients that we should be taking on, especially when they have infertility for HIFU. Next slide, please. Okay, maybe you better do the interpretation before I go into the complaints that we had from patients. Now, I want to go over some of the complaints that we've had. A majority of these complaints are transient complaints that happen immediately post-op. 21 women complained of lower abdominal cramps, which is not unusual after HIFU. 3 women complained of transient leg pain. 7 women complained of lower back pain, and 16 women complained of skin burning sensation. I must say, these are just, like I said, it's out of the 16, it's only one that has a 1st degree skin burn, which of course we just applied dressing to. The others, there was no skin burn. So next slide, please. Now, after 1 week, and some of them after even 2, 3 menstrual periods after HIFU, about 10 women complained of heavy menstrual bleeding, still persisting. And 4 of these women had HIFU treatment for adenomyosis. And this has made us to modify. When we started, we were doing, after the HIFU treatment for adenomyosis, we would do 3 months of Zoladex injection, but we've extended it to 6 months after the this first 2, 3 patients that had heavy menstrual bleeding after, which we saw that actually decreased after only resumed after they have stopped the Zoladex. So we're doing 6 months of Zoladex. And one problem that we're still having with patients with adenomyosis is that none of them has been able to take a Pyrena, even when we offer them, because of the fact that we know that majority of them are, and they're finding it difficult to who's having an IUCD when they have infertility together. But it's something, because with any new technology, you need to let people, what we're going to be doing now is putting step by step before them, even before they go on what can happen, what we might need to do. So we're learning from our experiences. And 6 out of these 10 women also had type 2 to type 4 fibroids, who still had heavy menstrual bleeding after HIFU. One of the things that we know is that it's possible to HIFU treatment because it's ultrasound, and therefore the ovarian reserve is not affected. And that's one of the data we're also collecting. We're doing the AMH for women below 37, and what we have seen, we have not finished compiling all our data because, like we said, today is actually the 1st year anniversary. So we are going to compile our data and be able to publish some of the experiences that we have, including the AMH value. There are 10 women complained of mild watery vaginal discharge, after which persisted for about 3 months, and they are all in the care. Like I said, only 1 patient had mild skin burn after the HIFU procedure, was around the umbilicus, 0.5 cm, which only required dressing. But 1 patient also had persistent pelvic pain after the treatment, and this is a patient who had adenomyosis. The explanation is likely that she also has endometriosis in other parts, and which is one of the things also that we're going to be looking at. Who are the people, especially when they have deep proliferative endometriosis together with the adenomyosis. This is one experience that they might have. The pain might persist even after the HIFU. And this one of the things that we learned this 1 year experience. Yes, so all that's left for me just to conclude now, and I'll say that HIFU is well suited for our patients with uterine fibroids because majority of them also have infertility and they want to preserve their uterus. And also, fortunately, also majority of our fibroids are hypointense and therefore well suited for HIFU. And also, we are lucky that HIFU does not adversely affect fertility from all the data that have gathered about HIFU, including the ones our own experience here in Lagos, Nigeria. And one thing that actually excites me about HIFU is that I think over time, because we've also gathered some of the information with our patient with adenomyosis, comparing them with those who had surgery for adenomyosis, and I'm believing that the future is very bright for patients with adenomyosis who are treated with HIFU. And it's not unlikely that it might become the first choice in the treatment of patients who have adenomyosis and are desirous of future pregnancy. Of course, we need to do randomized clinical trials in order to be able to make this kind of conclusion or this kind of. And we are very ready and we're happy to join the HIFU family. And I can see Dr. Jody Rodriguez, who has joined us now, who have contributed a lot to this. We're also happy to be part of this so that we get enough data to be able to make this kind of assertions on this beautiful technology that we have. Thank you so very much for this.